All right. Good morning, everyone. Welcome to the October Brooklyn DD Council meeting. Hope everyone is doing well. Just a couple of quick updates from the Brooklyn Council. One is next week is election day for our president and a number of other positions. Please make sure get out there and vote. Big kudos to Brooklyn. I think Brooklyn destroyed all the other boroughs in early voting numbers. I saw that on the news this morning that Brooklyn came in way above the other boroughs, setting records in early voting. So I'm not surprised, but keep it up. We got to get out there. We have to have our voices heard. So that's great. But again, next Tuesday is election day. So please keep spreading the word, talking about all of our advocacy points and not telling people which side to vote on, but which side may impact us a little bit more. Always a good thing. Um, Other announcement from the Brooklyn Council. I want to welcome, I don't know, I saw Melissa, but we are going to be starting up our residential and housing committee. So we finally have our co-chair solidified for that committee. I know we haven't had that committee going in quite some time. So it's Melissa DaCosta England from SUS. I believe she's here and she can say hi in a minute. And Martham LK Brown Tuluk from Block Institute. So they both come with a wealth of knowledge and experience in the residential and housing world, and they're going to be great additions to the Brooklyn DD Council team. So welcome, Melissa, if you want to quickly say hi and introduce yourself.
Good morning. I am Melissa DaCosta England. I currently work at Services for the Underserved, and I am one of the VPs of Residential Services. I'm happy to join the team, and good morning, everyone.
Thank you, Melissa. So Melissa and Martha are going to work behind the scenes to set up their date and time for their meetings and get out the links and the Zoom info and all that. And as soon as it is, it'll go on our website and I'll blast it out to everyone on the mailing list. So you guys will have all the details so you can start attending that as well. Other good news from the council this month, we held our first meaningful day in employment committee. That was last week. Haida, I see you. I saw Marjorie. If any of you guys just want to give a quick update and say how that went and plug your next meeting, feel free.
Hi, everyone. So our meeting went well. We had a couple of participants. We explained the co-chairs. Everyone introduced themselves. And then we kind of laid the foundation for what the committee is going to be focusing on and kind of our thought process about having later meetings and our planning of hoping to expand it more to families and including more families. We discussed the meeting schedule a little less frequent, but also probably more frequent depending on what OPW or the DOE or kind of changes that come up and spring up at us throughout the process, so that people will be more inclined to join. So we're excited. Our next committee meeting is scheduled for January, but I think we may hold a small one in December, depending on the pathways, ADM from OPW or any of those kind of developments that are happening. But it was a great meeting and we're looking forward to kind of moving forward with it. Yay!
And thank you guys for getting that restarted. For anyone who didn't attend that meeting or is looking for more information, please go to our website, bkddcouncil.org. This committee is a culmination of a couple of other committees that we had last year, and we're made an effort to combine them because we understand everyone's time is valuable. And to expect everyone to be able to jump on 6, 7 different meetings a month was a little unfair. So the Meaningful Day in Employment Committee is a combination of the Employment Committee, the Children's Services Committee, and the Transition Services Committee. So it's covering a person's whole lifespan and talking about all the things you may encounter, all the resources available, all the services available. And it hopefully will be a group of professionals, parents, individuals, and care managers that can help guide you along the way and answer questions you may have when navigating all of the things that come up in a person's life looking for that needs services that's diagnosed with a disability. So thank you guys for getting that back going. Another quick update I just wanted to share, not necessarily related to the council. but I know a lot of times I share out in my email blasts or in updates, trainings and different things going on from the Regional Center for Workforce Transformation. So I just wanted to share, I got an email that anyone that does typically attend their trainings or uses their website for resources, they're paused, right? They're going to be paused as of November 1st. And the email I got states that their website and online resources will become unavailable for an indefinite period of time, and the website and associated resources will resume operation as soon as details for the next 3 years of the RCWT activity are finalized. So what they are advising is if there's resources on the website that you want access to go on there before November 1st and save them and download them so you have them, because it doesn't seem like they have a time frame for when that will be available again. So again, that's the Regional Center for Workforce Transformation. Make sure to go to their website, and if there is anything you utilize or you find valuable from them, because they have a lot of great resources for training staff, get on there before November 1st because they're going to be shut down for some time. Hopefully they come back because it was a great resource for this field. And the last announcement on behalf of the council, membership dues. So you've seen my emails. I believe we have it posted on the website. We haven't collected dues in the last 4 or 5 years, but things are moving much further past the pandemic. It's important to remember that all of the officers, all the chairs on the council are all volunteers, whether they're professionals or families or people receiving supports or wherever we come from in our walk of life. We are volunteering our time to put together all the council events and run these meetings. There is some cost involved in terms of the website and the email and events we run, and while we do charge for events, it doesn't always cover the cost of events. There are other things that we want to bring back to the council that used to be done in the past, like awards and recognitions and things like that, but without membership dues, a lot of those things still need to remain paused. I know at the end of the summer I had emailed out the membership due list and the details. I think it's $150 for the year. It puts your name and your agency's name in your website. Again, let me just clarify, this is only for agencies. This is not for parents and people we support or anything like that, but for all the agencies, which I'm looking at a lot of you on my screen, please get it back to the right people that can cut the checks to make this happen, because it does support the council. It does support all of our efforts. And by becoming a member, you get discounts at the events that we do for tables and things like that. You get your name and your agency's name and your agency's website put on our resources page on our website, and other things that may pop up throughout the year in terms of awards and things. It'll make you eligible for those events that occur. If you have any questions, you can feel free to reach out to me, and I can send out the memo again regarding the payments and where it needs to go. I think as of today, we only have 3 agencies that have paid so far, when I know we have 60 to 70 agencies that participate in our events. So I know it's been 5 years and it's fallen off people's radars, but all of the other councils didn't give as long as a gap, and we're all used to paying for those dues. So please, let's get back to that. If you need more information, please talk to me. And the last thing I'll say regarding the council, I try not to overwhelm people with our mailing list. I try, when there's a lot, to condense it into those newsletters I've been doing, but when there's not as many things or really important emails, I will blast them out one by one. But I understand we all have inbox overload and I don't want to stress people out. But please, if you would like to get off of our mailing list, just email me nicely. There's no need for rude or nasty emails. I've gotten a couple recently. Um, some people being quite rude and cursing me out. They don't understand where these emails were coming from. We're typically not putting people on the email list unless they request it or someone from their agency requests it. So I believe there is an unsubscribe button at the bottom, but if I understand not everyone understands technology, but just please reach out to me on the side and not try to CC the whole mailing list into an email where it's being rude or disrespectful to anyone involved. I would appreciate that. And that's all I'll really say about that. To any of my officers or chairs on the council, there anything I missed regarding council updates or any news you guys want to share regarding the council or your committees, or you want to plug any upcoming meetings for your committees? All right, I'll take that silence as a no. Oh, I
I
see Debbie's
raised
hand.
my hand.
Sorry, I apologize.
That's okay. That's okay. First, good morning, everyone. First important thing, Brian, you and I need to say this jointly. Whenever I'm the chairperson of the Brooklyn Family Support Service Advisory Council. Brian is the chairperson of the Brooklyn Developmental Disability Council. Christopher Greif, who is the corresponding secretary and runs our website, sends information out. We're not doing it. We do help the Brooklyn DD councils. They help us out, but we do have separate events. Am I correct, Brian?
Yeah, there was some confusion this last month regarding events and people confusing our two groups.
Right. The one important thing I would like everyone to know, when you get the emails about the Brooklyn Family Support Service Advisory Council's mini resource fairs, it's not the Brooklyn Family Support Fair. That's at Brooklyn College. I guarantee you, the minute that is scheduled, Brian is excellent about sending the information out. Right now, it's only the advisory council is only doing their mini resource fairs, thankfully, thanks to the Brooklyn Public Library, Inclusive Services. Do you also want me now to talk about do you want me to do the dates of the fairs for the resource fair that's
Yeah,
coming
you
up?
can bring them up.
Okay. All right. I'm going to do the advisory councils first, and then since if I don't see my co-chair from the provider, I'll do the report so we can get it out of the way. All right. Good morning, everyone. Yes, normally Christopher's here doing certain reports. First, I want everyone to know that on Friday, November 8th, at the Flatlands branch from 11 to 1 will be the first mini resource fair for the Brooklyn Family Support Advisory Council. Flatlands is on Flatbush Avenue and Avenue P. We are booked. We have no more table space, but any agency that wants to bring their information to us, please send someone there or come and bring your parents and your and individuals, anybody to come, and we will take your information and share it with everyone. Plus, the Brooklyn Public Library shares it with all of the branches. There's at least 59 branches, and they share it with everyone, and they put it on their website. So please, everyone, if you want to be on that list, you need to email us. And my email is B as in boy, F as in food, S as in son, S as in son, A as in apple, C as in cat at yahoo.com. And we'll be very, very happy to put you on the list. We do need people in the next month or two. We'll be also doing it at Park Slope. Now, the advisory council's main meeting now is going to be, we're going to be in person at the Grand Army Plaza, plus we're also going to be doing it also virtually through Ring Central. It will be on Tuesday, November 19th from 10 to 12. We will have Lucina Clark and Marjorie from the Legislative Committee. We're going to explain how we can legislate. If you visit, you cannot make it in person. Christopher will send you the codes to have so you can join virtually. We will be upstairs on the second floor in a room that can handle the virtual. So you could be either in person or or by virtual. Also, yes, the statewide did happen last month. Yes, the statewide is working on different projects. One of the big projects is getting as many things off the non-allowable list for the ADM reimbursement to the allowable reimbursement. So we are making progress. We have been, OPWDD is hearing us, but we know we have to justify everything. If you need to discuss this, you can email me at the same email address I just gave you. And as you see, that's my name, Deborah Greif. Now, I do co-chair the Provider Family Information Committee. We meet the second Wednesday of the month virtually from 10 to 11. We did discuss with the agencies. I asked them to let me know what problems has been coming up with the new form of how you have to do the ADM with filling out paperwork and helping the families with the justification, and everybody did say they would get back to me. I know it's a lot of work and there were the Jewish holidays, we understand, but we are slowly, what we're trying to do is to get the information. We're putting it on a spreadsheet with the co-chair of the statewide. Her name is Gail Pato. And as soon as we have more of our information, we will then share it. Also, and I'm only going to say right after our meeting, after the provide information, from 11 to 12 is the legislative committee, and Marjorie, as well as, no, I'm sorry, Maria Willis and Lucina Clark co-chair that. You could stay on Ring Central, so they're from 11 to 12. And the only other thing, as I said, in reference with the MTA, we're very lucky right now. Jana Lieber appointed Demetrius Krishlow to be the president of the MTA. And right now for access right, acting is Rachel, her last name, apologize. But Christopher has put all this information on the website. Please also, everyone, we're asking you to update, make sure all the individuals' contact information, your information is updated in the emails, because eventually, the MTA is going to go off of not using Metro cards. They will be using the Omni cards to be tested. So please make sure everybody's information is updated. Thank you.
All right.
And if
Thank you,
anyone has
Debbie.
questions, email me. Thank you.
Yep, you could email Debbie. You can put it in the chat, whatever works best. All right. So I'm going to pass it over to Nina from OPW for the OPWDD update.
Hey, good morning, everyone. Happy to be here. I don't have many new updates, so I'm gonna continue on some developments that we have in our agency, and I have spoke about it in the previous meetings. So our Modern Work campaign has been extended for 2 more years. Today, we have 227 nonprofit provider agencies who are participating in our campaign. Since launching in March, the campaign's advertising has brought about 303,000 people through to the website, and more than 20,000 job seekers have visited the pages of our provider agencies through this campaign website. In August, we have also launched a recruitment kit that is available on Modern Work campaign website, and this kit helps the agencies to enhance their recruitment activities. So there is no fee to join, and the providers who are not participating yet, please, you are free to connect with the communications office at OPWDD and join the campaign. Okay, so early voting has started, as Brian mentioned. I plan to vote this week, and the early voting started on Saturday and will run through November 3rd, and election day is November 5th. Anyone who needs assistance with voting, you can contact our OPWDD National Voter Registration Act liaison, Michael Orzel. I can share his information in the chat. With continuing on our efforts with direct support workforce shortage, it remains our agency's most immediate and urgent concern. And you probably know that OPWDD dedicated 76% or over $1.25 billion of its American Rescue Plan Act funding to the DSP concerns, and we have made direct payments to voluntary service providers agencies for their DSPs, and we also investing in numerous recruitment, retention, and workforce support initiatives. On September, I have some CDPAP updates. On September 30th, Governor Hochul announced New York State statewide public partnership, PPL, will move its national headquarters to New York State. The move will create about 1,200 jobs for New Yorkers. PPL, Public Partnership LLC, will work with 30 regional home care partners to ensure multilingual and culturally sensitive care continues to those who participate in the CDPAP program. As part of this process, CDPAP eligibility for home care users will not change, and individuals who receive care through the program will not need to reapply. This process of working with CDPAP company will ensure caregivers continue to receive timely payments and avoid disruptions in services for those who relate to the program. State officials and partners will now begin a comprehensive transition process that will include direct meetings with CDPAP users, caregivers, disability and aging advocates, and other stakeholders throughout the coming months. As you know, OPWDD has its own fiscal intermediary program outside of DOH through self-direction. Our self-direction program will remain as is. Some people in our system utilize both CDPAP and OPWDD services. While we do not anticipate any disruption of services related to CDPAP changes, we encourage people to work with the care managers if they have any concerns. The next thing I would like to mention, I think about self-direction program evaluation. The Guidehouse continues to evaluate the self-direction program. They will engage directly with Self-Direction Developmental Disability Advisory Council Committee on the development of self-direction manuals for individuals and families, and bring feedback to the committee on the surveys that they conducted for individuals and families. The final report is expected in spring of 2025. With this care coordination program evaluation, American Institute of Research, they completed several focus groups with care managers, with self-advocates. They completed surveys and interviews with the families. And the final report is also expected in early 2025. We're excited that is coming to the end, and we will have some updates. And finally, with HCBS waiver renewal application on September 27, we have received the approval for a 5-year HCBS waiver renewal application, which went in effect October 1st, 2024. With this approval, OPWDD means its authority to operate the comprehensive waiver, which provides a full area of person-centered, community-based services to nearly 100,000 people with developmental disabilities. And the most significant changes in the waiver were to update the projected waiver enrollments figures and fiscal neutrality calculations. What else? Our agency is working on Home Enabling Supports ADM. Early in June, we have released the draft of the ADM, and we were collecting feedbacks. Right now, we are finalizing the RFP, and which will be released soon, to choose the providers or contractors who will be delivering assistive support services. And the other thing I can mention that the April rate has been released, and updated and approved, and providers received the finding for April rates that included call increases, and July rates are being finalized by DOH right now. We were waiting for information from some providers, and right now DOH is in final stages. And once they finalize the rates, they're going to go to Department of Budget, right? And all agencies were shared were preliminary rates for review. And I think that's it for me for today. I don't know if I missed anything. With managed care report, I think I also spoke about it last time, stating that the report came out at this time. It doesn't look like the Guidehouse is recommending the managed care, and they haven't evaluated the fiscal aspect of that program. So OPWDD is not going to make any changes at this time.
Thank you, Nina. I have 2 follow-up questions, and then I'll look to see if there's any others. The first one, going back to your first statement about the More Than Work campaign. I've been on a few meetings or in a few different settings. People have reached out to me. I know when it first started, there was a email you guys introduced and talked about it, and you put in a contact. And usually when I'm getting contacted about it, people are having trouble, if they haven't participated, who to reach out to. So I've been directing them to the communications.office at
Yeah.
OPW, and they're saying that at the beginning they were getting responses, but they felt that they haven't been recently. Is there a better email, or that's where I should keep directing them?
Well, that's the email that we have, communications.office at opwny.gov. But if someone reached out to them and they have not received a response, they can reach out to me and we will do the internal follow-up.
Okay, thank you. So I'll let them know if they reach
Yep.
back out. And then the second thing was about the last thing you talked about regarding the Guidehouse report and the recommendation against managed care. And you stated OPW is not looking to make changes right now. Are they going to come out with a formal response? I know I asked that last month and it was still new, but is there going to be some type of formal response we should be expecting?
I did not hear about the formal response. I did not hear that OPWDD will be providing that. It's just we are not, right? If OPWDD decides to pursue or to explore further, they made it very clear that they will engage stakeholders in the discussions.
All right, thank you.
And I'm sure more to come.
Thank you. Does anyone else have any questions for Nina? Go ahead, Rochelle.
You're probably muted.
Unmute, yes. Good morning, Nina. Just a quick question. I know you reported on the awarding of the ombuds contract to CSS last time. I was wondering if you had any more detail on plans.
Yeah, I have the same same updates. Is that we continue to recruit our staff internally, right, as well as providing technical assistance to the office that will be overseeing and operating ombudsman program. So I guess hopefully we will have more information by the end of the year. But that was the initial plan, as far as I remember, is to get started by the end of the year.
Okay, thank you, Nina.
Okay, I don't see any other questions or hands, so I guess you are free. Thank you, Nina.
Thank you. Thank you.
All right, next up, we will have Richard Bosch with the IAC update.
And here I am. And just on the ombudsman issue, we're going to try to get them to visit IAC. But I think it would be good, all the 5 PD councils in the city, it would be good if the ombudsman did a presentation. I don't know if they're ready yet, but I think you're the people that they need to speak to and get the word out. So I got a number of items that should be quick. This more urgent message. The early intervention system started using what's called EI Hub. It's a data system for processing the people through there. And wouldn't you know it, in the first few days of operation, they had some snags. There's delays in referrals and other issues. But just so you're aware of it, it's very slow, and it's really have an impact on referrals. If you I'll see if Chris Trieber can get more information out to everybody. I'm not sure if there are any EI providers on this call, but just be aware that it's moving slowly. The second thing I'd like to share, just some of the notes from the last Provider Association meeting. That's where the commissioner and her staff meet with the Provider Association heads, and they put out the notes from that meeting. And some of the key notes is that, the governor issued a new executive order making New York State an employment first state. Apparently there's some videos on the OPWDD website. And the aim is, of course, to get more of our people employed. That's something to look at. Fiscal intermediary contracts, that's been an issue with providers, that the contracts needed revision, needed kind of a new approach. And there's going to be a webinar in a couple of weeks to review the changes and methodology to calculate renewal amounts in that contract. So keep your eyes open. When we see the notice, we'll get it out. But the whole fiscal intermediary self-direction program has been a hot topic lately, and especially the contracts that New York State decided to use to run the program. And OPW is not, just people know, OPW is not the one who dreamt up, oh, we need a 5-year contract. That came from the Office of State Controller. And I think it's been widely accepted that self-direction program doesn't match well with a 5-year contract. It needs to be a little more flexible and fluid, but I don't know where that's going to go. Probably nowhere. The 24-25 cost of living adjustment, the COLA, which was 2.84%. People are starting to ask, so where is it? Well, the first thing is, agencies are required to sign an attestation about how you're going to use that money and the timeline. And word from the Provider Association meeting was that it's about to be finalized and sent out within the week. For those with looking to find out, and when your staff are asking when we're going to get that COLA, that would be the first step, is signing the attestation. And then we have the July 1st rates, which it's in July 1st, 2024. They're still not out. Word as of last week is that they're being finalized and sent over to the Division of Budget, and then they'll be issued. But they made a point, OPW made a point of saying there will be retroactive recoupments where the rates were reduced. Of course, there'll be retroactive payments of what's owed, but if the rate went down, they'll be retroactively recouping money. And the other, I think, significant issue is that once again in our system, we have a problem or a scarcity of quality dental services for our people. And they're looking into that. We're trying to find out what parts of the state have shortage. I think it's always been a shortage in New York City and probably elsewhere. So maybe that's something, Brian, for a future agenda. Anyone who provides dental service to our people, if someone has an overview of that. I think HeartShare used to be the main provider of specialized dental services. But
we had a great vendor at our fair in June. I think it was NYU.
Oh, okay.
So we can see if we can get some representatives from them to connect and do a presentation.
Okay, I mean, I remember the days where OPW had a program to get physicians into our system as well as dentists. And I'm not sure where that all went. So that's it from the Provider Association. My third agenda item, of course, is the November 19th rally at the Capitol. That's being overseen by NIDA, New York Disability Advocates. It's going to be in Albany at the New York State Capitol building in the War Room. That's where we usually have the annual rallies. War Room's on the second floor. It starts at 11, but if anyone's planning to go, plan to get there early. First, you have to find parking, which is underneath. Probably the best place is underneath the concourse of the Legislative Office Building. And then you have to get through security, which will take you some more time. Make sure you leave your pen knives behind because you won't have it anymore once you go through security. Brian, you probably remember the time when there was some rally event of the hunters or something, and they all carried pen knives or some kind of knives, and they had big buckets of where people had to deposit their knives, never to be seen again. Leave your knives behind. So November 19th, 11 a.m. You'll be seeing more notices coming out about that, urging people to wear orange so we can identify. And it's right outside the governor's office, and she will hear you all. But they're always very successful. So look forward to all that support. The main, I think I may have mentioned this last time, but the main three things that NIDA and the providers are looking for this year, and we've already put this position out because we want to get it into the governor's budget. She'll come out with her budget in early January, and if it's in the governor's budget, you got a good chance of that getting through. If it's not in the governor's budget, that's what all the lobbying in January, February, and March is. So the big ask is for a 7.8% Medicaid rate increase, which reflects the actual cost of care made up of the consumer price index in the current year and the previous 2 years where it wasn't included in the rate. Adequate wages, of course, are the second big ask, and we're asking that the legislature mandate that a Human Services Wage Commission be created to really study the industry, the turnover rates and staffing shortages. And
Richard, I don't know if it's me, but I can't hear you.
Yeah, I can't hear him either.
All right. It says on your screen connecting back to audio. Yeah, it appears you lost your audio, Richard. It keeps flashing up, connecting to audio, and then it goes away.
Mhm.
Yeah, try to sign off and right back on. For everyone else here, for what Richard was just talking about regarding NIDA, New York Disability Advocates, and the rally and the talking points, I just shared to our website where we have it posted. And we have the ask. They came up with a few different flyers. It looks like one is for families, one is for the agencies, but it is really three main talking points, as Richard mentioned. So you can find that by clicking on the link I just shared in the chat room.
I'm back.
Yeah.
And your sound is back.
Yeah. No, the problem is we use Zoom and a Zoom phone system. And when someone calls, it goes right into my cell phone. And so just ignore that. I don't know if you can hear that.
Yeah, we do that too, and there's a setting if you need help. You can, when you're in an active meeting, you can have the calls automatically go to voicemail instead of interrupting the meeting.
Okay, I'll do that. Sorry about that. So the Human Wage Services Wage Commission, they want that created. And then finally, the third big item is enhanced capital funding to our day and residential sites, because the state has a major agenda item to be a little more climate friendly, including our group homes, so that we're going to join in that piece. So I have to find out more details of what OPW and the state are planning for that. Lobby days. Just keep repeating this. It should be a notice out in December. The main lobby days are February 25th and 26th. We're doing it the old-fashioned way, which is most of the people will go up and stay at one of the hotels in Albany. We've been negotiating with the Hilton. Hopefully it'll come down in price and we can do that. And people will stay overnight, get a good briefing. IAC staff will make appointments for the people coming up. So you can visit your legislators and other legislators that are most important. And then Education Lobby Day will be May 6th in Albany. That's later because State Ed sends its budget request over in mid-April. So we'll know what DOB thinks about that by May 6th. So next would be, IAC has a training program, as most of you know, and I posted the link for that early on in the meeting. So just look at that. And that has not only the trainings coming up, but also events such as committee meetings. So if you're an IAC member, you can find out when the next committee meeting of your interest will be. I also posted the state ed rate reform. State Ed's undertaken the reform of the rates. It's been an ongoing issue, but they're getting very active on that. So I posted the paper on the rate reform and they're looking for comments on that. Where's number 6? Okay, that was it. Then 2 last ones. IAC since 1999's had a capital finance program, so either residential or day programs or clinics or schools. We can finance those programs with a fixed rate for the length of the loan. It's been very popular and saved providers and the state a lot of money. So if you have a 3% interest rate, when you close 25 years from now, it'll still be 3%. If you get into a variable rate loan with a bank, after 5 years, they're going to adjust that rate, but OPW won't necessarily adjust its rate to match that, at least not right away. So if you have any financing questions, just contact me at richard@iacny.org. And finally, just a reminder that IAC also has a transportation service program called Interagency Transportation Solutions, IATS, and some people insist on saying IATS. As Brian knows, it's a pet peeve of mine. People turn acronyms into a word, but that's it was created to provide quality and cost-efficient transportation services for people from their home to their day program. That said, those are all my priority items. Any questions?
No, nothing else, Richard? Did you see my email?
Oh, no, I didn't see your email.
I was just wondering about your email from last week, but that's fine.
Oh, the email I sent out last week?
Yeah, that's up to you.
Yeah, no, I should announce it since after almost 32 years at IAC, I've decided to retire, effective December 31st. It's been a blast. Things have changed. I'm getting too old for this, but you know, it's been wonderful. And I think the DD councils are one thing I've always been very proud of, to be part of it, to help it help the DD councils exist and be part of the whole system. Nowhere else in the state do they have DD councils. And so hopefully everyone continues to let the OPW officials and county officials, but this is a good way to get to the grassroots. Where else do you have families, providers, education providers, OPW providers, Board of Ed used to participate, the city department used to participate and starting to do that again. So they're very unique and very helpful. So it's been fun, and I'll be here next month, I think. So, thanks, Brian.
I didn't mean to put you on the spot, but I figured it was
Okay.
important. This is a group that would want to know you've been so involved with us. We appreciate all the updates and all the work you've put in with the field and with us in Brooklyn and being part of this council. So definitely deserve your kudos for all of that. And I don't know if you could see, there was tons of the applause, the little reactions through everyone's little faces. Because thank you for everything and
I've gotten to
all
know
that you've done.
I've gotten to know a lot of people. I mean, last month I went into a lab at a hospital so my wife could get blood work done. And what's the nurse's name? Mary McGuire. I said, wait a minute, I know you. I know she's on this call or was. So,
Uh-huh.
So Mary, I didn't know you were a nurse. Did a good job. Got the vein. So anyway,
That's a
it's been.
TLC.
You have a relative who's a nurse?
My daughter's a nurse, but her last name's Weaver. But you will be missed, Richard. But we're happy you're moving on to that next fun chapter.
Yeah. Okay. I hope it's fun. But no,
And we know people don't ever actually fully leave this field, so I'm sure we're going to see you because people always find a way to stick around for something or other.
Well, I'm not Fred Wetzel, you know. But no, it's I got into the system in 1973 up in Massachusetts at the Fernald State School. Somehow found my way to New York, worked for the Brooklyn Placement Unit, now known as the DDRO, and then ended up the Trade Center and then on to IAC. So it's been fun. So thank you.
Thank you, Richard. I think there's a couple questions for you. Rochelle, I saw your hand first.
Yeah, thanks. Again, congratulations, Richard. I remember listening to you for so many years now in the council, and you've always been such a wealth of information.
Thanks.
I am going to bother you though, because I always do. And my question is this. Many families who use self-direction have been asking me because they have seen NIDA's flyer about asking for the Medicaid rate increase, and they're wondering what that means for people using self-direction. Now, you know, when we use the COLA format, and I understand why we're not using the COLA demand now because the legislators got too confused by it, then people in self-direction knew that they were going to get whatever we got for a COLA, they would get in their budgets. With this new demand, you may not know, but I think it's important because we had unity among family advocates about advocating around the last few years of demands because they covered everybody. And right now, self-direction folks are feeling somewhat confused.
Yeah. Didn't self-direction get the same COLA, or it just hasn't
They
been?
got the same COLA, but now we're asking for a Medicaid rate increase.
Oh, okay.
Okay, which is different, which would probably go to the FI. But what would it mean for individual budgets?
Yeah, well, the reason for asking for a rate increase is just getting the state to recognize, DOB to recognize a lot more costs than just staff.
Yeah.
And last year it got confused because COLA used to be just staff, and then they had you'd get a trend, and that was for everything but staff to recognize the costs of running an agency and running buildings and heating oil and insurance and that. So what it would mean of this, I don't know. We'll have to see what the comeback is.
I would ask you to please raise that
Yeah, I will.
Because
Um,
it's becoming a problem in terms of organizing.
yeah, I wouldn't be surprised if OPW and Division of Budget are going to come back with saying, well, you've got to break it out somehow, or how much will go to staff. Because what happens is staff hear that, oh, that there's a, 2.8% COLA or 4% COLA. They say, well, when am I going to get my 4%? So they're going to have to answer that, and I'll ask Winnie and the other people to be ready for that.
Okay, thanks, Richard. My last father.
All right, and Debbie's hand is up for you, Richard.
Okay. Where'd you go, Debbie? Oh, you're on mute. Deborah, you're muted.
All right.
All right.
Okay, I
Oh,
got
there we
it.
go.
Sorry.
There you go.
Hi. Okay, Richard, it's from the advisory council. We want to wish you good luck on your retirement. You still haven't come to any of our meetings, and our next meeting is going to be the same day everybody's supposed to go up to the war room. So,
Well,
we got. I can't do that to the public library.
I know,
And first of all, for them to give us the site and the to help us do it a combination virtual and in person. This was planned. Actually, you wouldn't be surprised, 6 months ago. So I didn't know you guys were going to do up to the war room on the 19th.
I had nothing to do with it. That's
I
all.
didn't
I was
say
gonna
you
say
did.
that's
No, 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 no.
that's a NIDA thing. Was just the messenger.
No. I'm not blaming you, Richard, at all. I just want you to know that NIDA wants to know where's Brooklyn. Most of us are staying down here. So no, we're not blaming you. I'm just letting you know, but we appreciate all your advocacy work, and we hope you enjoy your retirement because you've earned it. So
Thank you.
that's what we
Appreciate
want.
it.
You're welcome. That's
Yeah.
what we want to say.
I should have retired
You know-
10 years ago, but I just couldn't get around to it.
Oh, because you like all of us too much. That's why don't you tell everybody you really like us too much?
That's
You don't
it.
want to. You really don't want to leave. You understand? But
Thank you.
even
Dave.
in retirement, if you want to, you can always show up to our meeting. We don't mind. Okay.
Okay, I'll sneak in.
All right. All right. Thanks a lot. Enjoy
thank you.
retirement. You're welcome.
Well, at least you can count on the consistency, Richard. All right. Thank you so much for your update, Richard. And I know we'll see you next month, but please feel free, reach out to Richard, send him your well wishes. He deserves it. He's really put in a ton of work for the field over the years.
You like
Thank you.
All right, I don't see any other questions, so thanks again. I did see Rihanna McKenzie from DOHMH is here. Rihanna, is there any updates you have for us?
It's not. Good morning, everyone. No, I don't have any updates today to provide.
Okay, well, thank you for being here.
You're welcome.
All right. Next thing that was on our agenda was I wanted to quickly talk about, or maybe not quickly, depending, but hopefully quickly, the Coalition for Whole Person Supports. This is something, if you're from an agency or a professional, you've probably gotten a number of emails regarding, and if you're a family or an advocate, maybe you're less familiar with it, but I know there has been some outreach to try to get more involvement from families and advocates. And the reason I'm bringing it to the council is they're looking to spread the message to the councils about what this is, but also to try to get sign-ons from the councils. And that's something that all of the councils has kind of paused with, because it's representing a lot of different areas and we don't necessarily feel comfortable with it. So I definitely wanted to present it and share it. It was included in my email, the attachments. I put a link in the chat earlier. So let me just give a brief overview, and then you guys will have information. You can check out the website. You can send in questions, get more involved with it if you are so interested. But basically, The website is wholepersonsupports.org. You'll find the link I put in the chat earlier. And they came out with a letter from the Coalition of Whole Person Support and its Integrated Care Matters, a statement of critical importance for the field supporting persons with IDD and their families. I think the most recent version of this letter was dated August 27th. I don't believe there has been a newer version. But it is something that is not a finalized version. There are changes that are happening to it as the process plays out. But basically, to summarize, the document titled "A Statement of Critical Importance for the Field Supporting Persons with IDD and Their Families" outlines the need for a transformative overhaul in the system for individuals with intellectual and developmental disabilities in New York. I believe the coalition is started or is headed up by a former commissioner of OPWDD or acting commissioner, Courtney Burke. I forget which group she's a part of now, but she has been the face and the front person for this and getting involvement. It's a coalition of leaders and former officials and advocates for reform to address decade-old issues in service provision, integration, and financing. Some of the key points that they discuss in this letter, they go over the historical background, the current system that we're working in and living in and dealing with on a regular basis originated from reforms following the closure of large institutions that everyone's aware of, like Willowbrook, in the 70s. And while at the time was groundbreaking, it did not achieve full integration or quality healthcare for the population we support. There's issues in service evolution. Despite the adaptation of the home and community-based services waiver, progress towards integrated community-based care has been slow. The waiver led mainly to development of more group homes and treatment centers rather than comprehensive community integration. They talk about current challenges. The coalition highlights how systematic underfunding, frozen rates for key services, fragmented care models have also failed to support the needs of the population we support. And additionally, the rising number of people diagnosed with complex needs like autism, dual diagnoses have strained the existing system. They talk about a vision for reform. The coalition calls for a new framework emphasizing person-centered, coordinated care that allows individuals with IDD to live more fulfilling lives. This model would focus on flexible, sustainable, and outcome-driven support systems. They touch on next steps, how over the coming months, the coalition wants to engage with stakeholders, with families, with individuals to formulate a plan that enables whole person care and support for IDD individuals and their families. And again, the coalition's members include various executives, advocates, former governmental leaders who are committed to reimagining the support framework for this community. The bottom line is the coalition was formed because we've spent the last decade plus fighting the system that was put in place and handed to us, where I think the mindset now is instead of waiting to see what comes next and then spending the next 20 years fighting it, why can't we all have a voice in shaping what this new model will look like? And if we can all say what works and doesn't work in our system and what would make the system more functional, more affordable, then we can actually spend the next decade providing really top-notch quality services to the people that need it and want it versus fighting the system while also trying to support the people that are in the system. So again, I will post the link again when I'm done talking, but it's wholepersonsupports.org. There are letters, the letter that I just briefly summarized, I mean, it's much longer than the few minutes I went over it, but it's not super detailed yet. It does also attach all the agencies that have signed off. And just because an agency, you'll see their sign off on it, it doesn't mean that they agree with everything said in it, but part of the sign off is that you want to be a part of the process. So if you see an agency that you're involved with signed off on it, it just means that they want to be included in where this is going. It doesn't mean that you necessarily understand agree with everything that's written within. But aside from them looking for individual sign-offs and family sign-offs and professional sign-offs, they're also looking for people to get involved. They're looking for people to be part of committees and work groups with them. And all of that information is on their website. I think they do have the ears of the powers that be with this, but how long it'll take and how far it'll go, I think it's too early in the process for us to fully understand and know. but it is important for everyone to be aware of this is the movement to help shape the future of services in New York. So be part of the conversation as opposed to finding out after the fact and then trying to fix something that we could have been a part of.
Well said, Brian. If I could just jump in here without putting my hand up because I
Please,
figure out how to
please.
do that. The one message I'm trying to leave with is when this system was created back in the mid 70s and definitely through the 80s, it was all about collaboration. We would get together at 44 Holland Avenue up in Albany, and the providers, state people, families, self advocates came later, but it was all about collaboration. OPW was created by a team of people who worked in the nonprofit sector. You know, the family groups from the Nice Sharks and the religious groups and Catholic charities and the Jewish organizations. It was that's who they looked to. That's who the state looked to create this new system in the community. And we're really fortunate back then that Governor Carey was the governor and he had a sibling who had a developmental disability, and he gave OPW kind of a blank checkbook to develop whatever services that people needed. And he also had the federal judge, Judge Bartels, who made sure the services were being delivered. So we got to get back to that somehow. We have a whole administration in Albany and administration of our providers who weren't around in the beginning, and everyone has to learn how to collaborate again to make something work and stop writing so many regulations. I mean, come on. So anyway, that's my message. Collaborate. OPW was always that way, and then kind of got lost with the new governor. The city used to play a major role in the service system. And would like to see the city get back in. That kind of went away when Medicaid showed up. And the city didn't have to start spending its money. Actually got to save it. So get back to collaboration, and hopefully we can break down those barriers that have been put up. That's my two
The
cents.
other thing to realize, it's a completely different generation of people now in the service world, in the service side of things, in the family side of things. And there's different opinions and different voices and different mindsets and great ideas that people just don't understand or don't realize the avenue that's available for them to be able to share and be a part of the future and the change in this service delivery system. And there's no time better than now. With everything going on in our political climate, we want as many hands on deck as possible to help shape what is going to be the future of the service sector.
On that
Get
note,
involved.
Ryan, I was wondering how I can sign up for the whole person support.
So I put the link in the chat,
Mhm.
and there's a number of places on there where it either says join the conversation or get involved. And you can enter your information and you'll be part of their email list and get more information. They hold webinars, they hold informational sessions. At some point, if we get more interest here and people want to get more information, I can see how about getting someone from their team to come on and do a more formal presentation than the overview I did. But I feel like it's important for everyone to know sooner than later about the conversation being had behind the scenes, because the motto should be nothing about us without us. And that's often how it goes. It's always we find out after the fact, or families find out after the fact, and then you feel disempowered. But yeah, if you click on that link, there's a number of ways on there where you can sign up and get their news and updates, and or look and reach out for volunteer opportunities to be part of their work groups.
So I just sign up. I'm gonna see if I can sign up for the volunteering group. Because like you mentioned, the way the service delivery model is working right now, it's too obsolete. And we appreciate the advocacy that was done 30, 40 years ago, but I think a new voice of workforce, particularly in the past 15 years, have a lot of insight into how things can work out moving forward. Thank you for sharing it.
No problem. Debbie, is your hand up from before, or you have a question? All right. if there's, I don't see any other questions or anything. Again, the link for that is in the chat. Um, and just get involved and at least sign up for the newsletter so you know as things are progressing, how things are looking with this and what impact it could have and how you can be a part of the change. All right, so I don't really think there was much else on the agenda except for announcements now. So I can open it up. I know some people were putting their announcements in the chat, and I recommend everyone, even if you're gonna say something, put your announcement in the chat because the chats do get posted with this recording after the meeting. Debbie put in the chat, Courtney Burke was the commissioner. Yeah, so she is the main person behind this. But I also know in a couple meetings, and maybe Richard can clarify if I misspeak, at some point she will have to step away from this project as it takes off because it can be, I guess, looked at as a conflict because she was the former commissioner. So she can only take this project so far, and then it has to be handed off to people that are currently involved in the field and families that are currently have loved ones in the field. But she is the main person behind it now, and I believe she's part of the SACS group that has put this all together. All right, Rochelle?
Yeah, just to add to that, I certainly believe everyone should try and be involved with this because, if you're not at the table, you're lunch. So, and we don't want to be lunch. And, there were concerns because families in particular were brought in very late to this process when the letter was already done, the point of view was already shaped, etc. And so, but they've been, efforts to correct that and to include more families at this point, and there is supposed to be the development of a steering committee and an advisory board that's in process, but I haven't heard much about it in the last few weeks. I will say Courtney Burke is a consultant, and she's a consultant being paid by somebody, and that's not really clear exactly who's, the motivating force behind this. And it's just a concern of mine that I'm sharing because I think, the people who are driving this need to be transparent and we need to know what's going on. And perhaps a little nudging will help that to happen sooner rather than later, because you have to kind of know who the leadership is and who you're dealing with to, have an effective voice. But that being said, it's still really important because the system will have to change. And it's going at a snail's pace now. And the kind of changes that are being made are not necessarily the kind of changes that either providers or families or self-advocates really want to see. So if we don't do anything, things will continue the way they're continuing. And that's really not a viable option. And I do believe our new commissioner, acting commissioner, Commissioner Bear, is interested in having dialogue and is interested in having a discussion and is aware of this group, the whole person supports, and comes to their events. So, I think hopefully the collaboration that Richard talked about that was in the early years might actually reemerge during this period.
Richard, sorry, Brian, I finally was able to unmute. She was our commissioner like 5 commissioners ago. She was right after Diana Jones Ritter. And the one thing was she was very open-minded and she wanted to hear what the parents said. And she never really missed a meeting. We miss also the statewide advisory council misses meeting in a way at 44 Holland. But because of the open sunshine law, we have to meet in where they now have us. But the problem is that we don't always get the commissioner to come. I'm not angry. I'm disappointed because we want to talk with whoever is our commissioner. And the other issue, like Chris and I have been hearing if they're inviting us to participate, but we probably will do some, but we're concerned because you see, we want to know, are you going to be open-minded enough that say certain families who want their children their children who could work? Do they also understand the issues that happen with the benefits? Are they willing to work like with the ARC to try to raise the Social Security allowance benefits so that if you work and you're collecting under your parents' Social Security, because that's a Social Security law, that you're not going to lose your Medicaid waiver? And also, we have to constantly educate the elected officials who don't, because I'll tell you, the former Governor Cuomo, according to him, he did not understand why our children need services from birth to death. I'm sorry, but there is no cure for a developmental disability, and a lot of people don't want to understand it. And we also have to work with getting rid of the stigma, because a lot of individuals hide their developmental disabilities because of the way they've been attacked by society and their own families. So there's a lot of work that has to be done. So I'm wondering, can they do it?
Oh, I think they have a big following, a big group that they've gotten to sign on, and all the
Mhm.
points you brought up are very valid. But again, that's why they
We'll
want
see.
people to participate and be part of this, because they want all of what are they missing? What areas haven't they touched on, and how can they get it
Mhm.
included to help shape this? So I think if you reaching out and being a part of it, I think you'd be a great resource for them to pick your brain and see some of your experiences and be able to contribute.
Well, I would like also to, the one issue we have is they feel because if you're a parent of a child who's technically considered high functioning, why aren't they working? They don't also understand it's not just only the developmental disability. Our population, our children get a lot of have different physical health illnesses that if they went to work can lose their medical coverage because they have pre-existing conditions. One fact is that many of our males get liver disease as a child. And once they see that word liver disease, all of a sudden your insurance levels to be covered go so high that if you went to work, you would be working just to pay for the medical insurance and you could not afford your rent and other things. So we do
Hmm.
need to educate a lot of them because the reason they said, oh, he should be working. Well, I'm sorry, we don't want someone to lose their medical coverage because liver disease can kill you if you don't have it monitored regularly. And people don't want to understand that. So that's a big issue too.
All right, thank you.
Well,
You're welcome. Can you help me
Okay,
mute, please? Because my phone's acting up.
sure.
Thank you.
All right. So again, go to the website, check it out, sign up to be on their list, get involved, and that'll be the best way to get a better future for this population in the field we work in. Um, all right, so announcements. Doris, I see your hand up.
Yes. Good morning, everyone. My name is Doris Khan, and I am the outreach coordinator for the New York State Institute on Disability. We are a family support agency. We have availability for evaluations for those individuals who are seeking OPWDD eligibility and do not have Medicaid, and they live in Queens, Brooklyn, Bronx, and Staten Island. Please contact Elizabeth Sunshine at 917-609-0578, or you can email Elizabeth at esunshine@nicidinc.org. NICID also offers behavior management services for individuals who live in the Bronx, Brooklyn, and Queens. You can contact Juliet Hawkins, who is the coordinator of this program, at 917-524-4856, or you can email her at jhawkins@nicidinc.org. NICID also has funds for reimbursement for goods, services, and camp for individuals who reside in the 5 boroughs. You can contact Jackie Tripodi at 929-202-1115, or email her at jtripodi, TRIPODI, @nicidinc.org. NYSED also has recreation outings, tickets to different events and places within New York City. And this is for individuals who live in the Bronx, Brooklyn, Queens, and Staten Island. We do not provide recreation outings for individuals with self-direction services or who reside in Manhattan. You can contact Sarah Alton at 718-494-6457, or you can email Sarah at salton@nicetinc.org. NYSED also provides transportation services for individuals who live in Brooklyn, Bronx, and Staten Island for medical appointments or recreation activities. You can contact, we do not provide transportation to individuals with self-direction services or who reside in Manhattan. Please contact John O'Grady, our transportation coordinator, at 917-747-9424, or email him at jogrady@nicetinc.org. Brian, I put this information in the chat. I want to say congratulations to Richard. Thank you as a outreach coordinator, aunt, and grandparent of handicap individuals. I thank you for your service. And I thank everybody else here for their service too. Thank you.
Thank you so much, Doris. All right, next I see Lindsay.
Hi, good morning. I'm Lindsay Stilson, the Outreach and Marketing Specialist for Goodwill. We have openings in our Day Hab Without Walls with a focus on employment, community-based pre-voc, respite, and our advanced services located in downtown Brooklyn. We are also having an open house scheduled in downtown Brooklyn on Thursday, November 21st. I have shared the flyer with the council, so I'm sure it'll go out to you soon. But if you do have any questions, you can email me at lstilson@goodwillny.org or call me at 347-906-2556. And all this information is in the chat. Thank you.
And please remember, everyone, if you miss something, the chat gets posted, the video gets posted, it's all being recorded. So you can always go back and jump around. It's hosted on YouTube, but posted on our website. So you can skip around and find what you need. We do put captionings up with it. I don't know if it's 100% accurate, but it's pretty close most of the time. Next up, Sandy.
Hi, everyone. I hope everyone's having a great day. Adapt Community Network we're having a few free webinars coming up. The next one is on this Thursday, October 31st from 10 a.m. to 11:30 a.m. It's called Transition of Youth with Special Healthcare Needs to the Adult Medical World. And Dr. Lynn Davidson from Montefiore will be our guest speaker. And next coming up on November 10th from 10 a.m. to 11:30 a.m. is Supported Decision Making, Creating a Future for Autonomy and Competence for Persons with Intellectual and/or Developmental Disabilities. Joan Carnaccio from Supported Decision Making New York and Karen Liebman from ADAPT will be our speakers. And lastly is on November 13th from 10 a.m. to 11:30 a.m. We're having Profound Autism. What is it and why is the term coming up now? And Dr. Lisa Schulman will be our speaker. All our webinars are free and we always provide Mandarin and Spanish translation. And we hope to see you there. And everything is on the chat. Also, the flyers are on the chat. So thanks, everyone. Have a great day. And congratulations, Richards, on your retirement.
Thank you, Sandy. Does anyone else have any other announcements for openings or any fun activities or anything going on at their agencies that they want to share?
That will be me, I'm Angel Nunez. Hi, everyone. A quick introduction. I was a care manager supervisor for the past 6 years. I recently came off because of the challenges that I was seeing in the service delivery model, which is why I'm interested in joining that coalition of whole person sources, because there's a lot that doesn't get said to the public when it comes to the coordination of services, a lot of deficit of staff, like you guys were mentioning and discussing today, and that sometimes, you know, impedes the services that the members need to be receiving at home. And I know that the Bronx community, the Bronx diversity, oh my God, no, I'm getting tongue twisted. The Bronx committees is doing healthcare, transitioning healthcare webinar. I believe it's tomorrow, regarding care for, you know, members that have medical diagnosis that, you know, sometimes impede them to obtain employment and participate in other, you know, community, including activities like they have and stuff like that. And here at Excellent, and my goal is just really to discuss services and how they can be matched with the current OPWDD services that families may currently have, or maybe that they're waiting to activate or getting approval for. So I put my contact information here if you guys, anybody here wants to explore how home care can be put into the equation for your family, for your member, your son, your daughter, because it's complementary to the OPWDD services. It's not going to be funded by OPWDD, but mostly through Medicaid. So the budgets are different, especially for families that are self-directing. And I know that an extra set of like hands at the home can be helpful sometimes, especially with the coming holidays. So if anybody has any questions and just want to get on a quick like discussion about how the service can be again put in the puzzle of services for your child, just give me a quick email or a phone call, and I will gladly join on it and discuss more with you guys. And thank you, Brian, for hosting this meeting. I'm going to be joining it every month. I see the value of it, and thank you to I'm getting familiarized with the names. The person that is retiring, Richard, yes. Like you mentioned, nobody really leaves the field. I mean, even though I step up from the care coordination side of things, my commitment to the industry is just I need to stay involved because I have family in the system and I see how it has failed, and I don't want families to go through that. So again, I help him hand here and a friendly face here also. So here to help.
Well, welcome and thank you for joining us. And just before you mute, what agency are you with? What home care agency?
Excellent Home Care.
Excellent Home Care.
Yes.
Okay. Thank you. Welcome.
Thank you.
All right. Any other announcements from anyone? All right. I don't see any hands. I don't see anything in the chat. So it looks like you guys will be getting back a half hour of your day. I'm glad I can do that for everyone. Please remember, go out and vote next Tuesday. Big day. Everyone.
It's open for New Year. I'm actually voting after this.
Yeah. Early voting is open. Like I said, when I started the meeting, Brooklyn was blowing all the other boroughs out of the water when it came to their numbers. So that was interesting to see on the news and good to see, but go out and vote. This is the year. If you've never voted before, this is the year to start. I think it's it's really going to shape the future of everything, your personal life, your professional life, everything. So get out there and vote, make your voices heard. And that's it. Thank you everyone for attending. Keep an eye out for my emails and check our website, check our Facebook. Try to keep it all updated as much as possible.
Thanks everyone for attending.
Hey, Brian, I wanted to add, the reason I came was because of all your emails, okay? So I want to thank you and for that. See you soon.
Thank you. Appreciate that. And thank you to all my officers and co-chairs and vice chairs. You guys all help make this a lot easier of a process than it probably appears to be. All right. Have a great day. Have a great week, everyone.
Bye, everyone. And Brian, coordinating this. Keep it up.
Thank you.
Bye-bye. Thank you.
Bye.
We need a history of communication.